Good morning, everyone. I'm Dr. Morgan Crossman, the Executive Director of,
Butterfly Futures, and my name's Emily.
and I'm joined today by my daughter, Amelie. And we're excited to celebrate the closing out of 2021 and another year of supporting children, families in the early childhood field as we navigate the COVID-19 pandemic. So we wanted to take a couple minutes out of our morning to share the highlights of our work and priorities for the coming year. We know that many families, providers, and programs remain in crisis during this time. And with that in mind, we're focusing on both short and long-term priorities to address the most pressing needs that you all have identified as stakeholders in Vermont's early childhood system. So two of those priorities are the workforce and mental health crises. This year, ongoing workforce challenges have escalated into a crisis in Vermont's early childhood system. There are concerns related to finding, retaining, and supporting a strong workforce, and those have been described by partners across the BBF network, especially our regional councils. This includes a variety of critical fields, right? So mental health providers, early childhood educators, early interventionists, and other integral providers. And we're really looking forward to sharing data about this crisis in a spotlight in this year's State of Vermont's Children and Families report. And that'll be released in January. This spotlight speaks to the critical state of hiring and retaining early childhood providers who care for and support our state's youngest children and families. For example, Head Start staff, who, 14% of whom left their positions from April to September 2021. Our mental health system is also in a crisis, facing our children, families, and the providers who are serving them. While our communities need more support than ever, mental health providers are also experiencing burnout and workforce challenges. And this year, they've reported the highest turnover rate ever reported at 31%. So what are some of the short and long-term solutions? In the short term, Building Bright Futures developed the Vermont Early Childhood Fund. Recognizing the critical and immediate needs identified by regional councils and early childhood partners across Vermont, BBF was really excited to award 7 grants totaling $100,000 for innovative regional projects that tackle some of the challenges we've seen across our state. So from workforce development in Lamoille County to addressing the basic needs and transportation in Franklin Grand Isle region to providing critical hearing screenings in Bennington County, we're really excited and proud of our partners who are going to be able to carry out such important and timely work. So as we think about solutions on the horizon, one of the more immediate solutions that we're monitoring is Build Back Better and how that relates to childcare, universal pre-K programs, and what that impact would look like for young kids and families in Vermont, and prepare our state to act. So some of the highlights in that bill include ensuring families pay no more than 7% of their income on childcare, increasing Vermont's current universal pre-K, so going from offering 10 hours a week to 30 hours a week for all 3 and 4-year-olds, elevating Head Start as the gold standard for high quality early childhood education with a strong model for family partnership, and thinking about expanding school nutrition programs, investing in critical housing needs, and more. So BBF is continuing to stand by to answer questions from both our federal partners as well as partners in the state related to this legislation, despite its current status and potential delay in the Senate. But if passed, this bill would help us make incredible strides towards realizing the vision for a well-resourced, integrated early childhood system that's outlined in the Vermont Early Childhood Action Plan. So in closing, I want to reiterate my thank you to everyone who's participated in and has helped continue the Building Bright Futures Network this past year, along with the entire early childhood community for tackling some of the most pressing issues that we've seen for children and families in the state. I'm really hopeful for the year of work we have ahead, and I want to wish you and your families a happy, healthy 2022. Thank you.